People living with diabetes are at the heart of absolutely everything we do. Together, we believe we can work towards a world where diabetes can do no harm.
Diabetes is the fastest growing chronic disease in Australia, and Diabetes Australia's mission is to reduce and eliminate the impact of diabetes on people, health systems and society. Taking a transformative, community-driven approach to research is essential to ensure that we're developing meaningful solutions that will address the problems of people living with and at risk of diabetes.
Community-driven research is most important. So we need to ensure that the research actually translates into policy, then ensuring that the funding models actually translate into clinical practice to make a real difference to the wider population we are serving, because the prevalence of diabetes is increasing, however, the change of impact is not.
As a researcher, I know that when we design a grant, what we're thinking about is how much money it's going to cost and how many papers it's going to produce. And even though that relationship is important, what we're trying to do with the Diabetes Community Priority Grant is change that emphasis and shift the focus into meaningful outcomes for people with diabetes. So it's not just papers at the end of the day, it's providing a solution to a problem that people with diabetes would recognise and value.
It's critical to include people with lived experience in diabetes research because really at the end of the day, it's nothing about us without us. With research, it's about maximising the relevance, the quality and the impact of research that comes through, which you can do by getting the source from people living with diabetes themselves.
When we're evaluating research projects, it's not just about good science. By having people with lived experience on the committee and providing input, we can ensure that these projects speak to the needs of people living with diabetes.
If you involve consumers from the very start of the research project, from conception, you get a better understanding of what their priorities are and where research should really be focusing on. So that way you're maximising the money that's going into the research to the product that's being developed. And finally, it's really about building the trust between clinicians, researchers and the community as well.
Working with the Diabetes Australia research team as someone with type 2 diabetes is really exciting for me, seeing the direction that research is taking and all the new innovation that's evolving from the research. There is a lot of stigma, especially around type 2 diabetes, and research is helping to break that stigma down, that it is not a lifestyle choice, but it is a metabolic disorder and it affects people from all walks of life. Diabetes can come with a whole host of comorbidities as well. So what I would like to see out of research is treatment and management attainable for everyone, tailored for everyone, making these lifestyle changes more accessible. With my strong family history of diabetes, it means I have hope that my children and their children will hopefully have a cure.
We want to co-invest research with our partners, including industry, government and the healthcare sector, so that we can embed our researchers within these environments to ensure that we're getting greater, more effective, realistic translational models that can accelerate the research into real-world impact for people living with diabetes.
We know the rates for First Nations people being diagnosed with type 2 diabetes is on the rise, and it is concerning. Type 2 diabetes is preventable, but our environments that a lot of Aboriginal and Torres Strait Islander people live in, particularly in the rural remote areas, is a challenge. Access to good food supply is sometimes a challenge, and so affordability, quality is very difficult. And if you can't get access to good food, then of course trying to prevent diabetes is a challenge, let alone trying to manage it. So there is hope. We're having programs now that are co-designed by First Nations Australians, and we're increasing our research investment for First Nations Australians to try and get them upskilled in diabetes education, as well as community members, which means that we'll have that lens over the data and that will contribute to the evidence base for Aboriginal and Torres Strait Islander people.
Community involvement is so important and is the heart of the research that we do today. This is the reason why clinicians get into the industry. This is why researchers come and do research. So really it's about improving the health outcomes of people living with the condition. And I think together we can definitely work towards that.
The end goal is to improve communities, patients, and clinical service delivery.
We want a world where people can live well and live long with diabetes. We want a world where less people are being diagnosed with type 2 diabetes, and we want a world where we're accessing funding for research so that ultimately one day we can find a cure.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.